It's great to have you back at Einstein's Eyes, our YouTube channel. I'm Carl Rosen, oculoplastics, neuroophthalmology in Anchorage, Alaska. I have my friend and partner. We were co-residents at Albert Einstein College of Medicine way back, John.
Nice to see everybody. Yeah, so I'm in northern New Jersey. I've been in practice almost 30 years, general ophthalmology, doing cornea. And I'm really excited to have Evan here today talking about a product that we actually use in my office. So I'll let Carl introduce him.
Yeah, so Evan, we're super excited. Evan Steele, we're super excited to have Evan on the channel. Can't wait to hear his comments and his experiences with the companies that he's built. SRS was an EMR he sold years ago and then started Rater8. Started out in finance, was a Wharton graduate, University of Pennsylvania. And so, Evan, tell us about your background, what got you started, how you developed and built your company, and really what Rater8, what it does and, how it helps physicians' offices run more smoothly.
And so Rater8 is a patient feedback company, right? So the first thing we ever did was surveys, just patient surveys. I remember my wife and I, we checked into a hotel in Prague, and it was a good hotel, got a terrible check-in experience, and there was no way to rate that front desk person. His name was Federico. In fact, our company's mascot is a little bee, it's Federico. And there was no way to rate Federico by name. So, I was kind of thinking, like, I love Uber because you rate the driver, and they used to be taxi drivers. They gave you terrible customer service experiences, but now that they're being rated, they're super friendly and super helpful. So wouldn't it be great to do the same thing for people, check-in folks at a hotel? And then since my background was in medical, the same applies to an ophthalmology practice with multiple offices. When someone's checking in, how is Mary or Joe at the front desk treating the patient? Are they giving the patient the art of the warm welcome? So the very first version of the software wasn't even a survey. It was just rate people, rate doctors, and rate staff by name. Then we added questions and we benchmarked. So now you could say your check-in experience, your scheduling experience, billing experience, clinical staff, tech. You could ask questions about those parts of the operations and benchmark them against other ophthalmologists and see where your practice ranks or stacks up, and then identify areas that need improvement, either overall, or you might have one satellite office that has a staff friendliness problem, and the software would tell you that using the benchmark. And then I remember my brother, who's an ophthalmologist and who's an investor in the company, an early investor in Rater8, he said, I love the software, I love the data you're getting, but my competitor down the road has more online reviews than I do. So why don't we try to, now that we're engaged with patients, we're emailing them, we're texting them, why don't we add redirects where we're putting URLs for like Google, Healthgrades, Vitals, WebMD, and we could build up the online reviews. And as it turned out, surveys are more or less, they're important, but they're more or less banal, where reputation management, building online reviews, is very exciting. So we really focused on building that part of the software up as well. And we lead with that, but I would say we're a patient feedback platform, whether we're sending out surveys and getting data to help your practice, increase customer satisfaction, patient satisfaction, or whether you're building online reviews and putting patient feedback online, we're good at both of those. And again, we do market ourselves as a online reputation management company.
So Evan, when it came to my practice, I'm sure you have the analysis. What'd that look like before we joined Rater8 compared to now?
So going back to 2019, when you started with Rater8, you had 8 reviews and 3.8 stars, much like Carl has now, 3.7 reviews. Sorry, 3.7 stars with 12 reviews. Fast forward to today, you have 288 reviews with 4.8 stars. So, when a patient gets a few names from their referring physician, to see an ophthalmologist, or they ask their friends on Facebook, or their, look on their Cigna, on their insurance guide online and get a few doctors, and they start Googling the doctors. John, you look great online. and patients can feel, it's like trust marketing. Patients can feel very comfortable booking an appointment with somebody where 288 patients have reviewed you 4.8 stars.
Evan, one question I have that I always get confused by. I know I'm listed individually, but my practice is also listed, correct? So those are different reviews, or this, do they like mesh together?
So they are separate. So uniquely, like most businesses, coffee shops, auto dealerships, you have 20 locations, you have 20 Google listings. Healthcare is a little more complex because each location has its own listing, right? So for the business, whatever main office and satellite offices, and then each doctor has their own listing. And on top of that, each doctor typically has a listing, a Google listing, for each office at which they practice. So if you practice in 2 or 3 satellite offices, you'll also, most doctors also have listings for those, personal listings for those locations. And on top of that, there's the health grades and the vitals and WebMD and Rater8. There's all those review sites that each doctor has as well. So it gets a little bit complex. There's a lot of listings in healthcare entities.
Yeah, we've seen I think any doctor you ask in the year 2024, we've always tracked since the first day I started in practice. How did you come to our practice? And we would keep track of it. And over the last, 10 years, it's obviously gradually gone to internet, Google, online, there's Facebook groups, there's a lot of other things as well. But, it used to be my uncle Bernie, but now it's much more internet based. And we still get word of mouth from, patients, of course, but it's a much smaller amount. And it used to be a lot more doctor referral. And now patients kind of seek it themselves.
Well, a perfect example. I recently had oral surgery, so up in Bergen County. So I went to my dentist. He said, you need an oral surgeon. Who do I use? He gave me 2 cards from the front desk, of 2 different practices. So in the old days, I'd call both, and whoever had the most convenient appointment time, that's the one I'm booking. Well, this time I Googled both oral surgery practices, and one was clearly doing a much better job online than the other. So now for me, I trust the one with all the reviews, and I don't care what the appointment time is. I don't care how inconvenient it is. My primary criteria in booking an appointment is they have great reviews. I'm using that practice. So even in a referral kind of practice, where patients still have choice, they get multiple practices of multiple doctors on a list from the primary care doctors, or primary ophthalmologist if you refer out to a subspecialist. So it's just very important to have those online reviews so patients get comfortable real fast making that appointment.
So do you have any customers in Anchorage?
Yeah, we do.
Oh, wow. Carl, you got to join on, baby.
Yeah, it's a little late for me.
Never too late.
It's different when you're the only octoplastic guy in Alaska.
That's true.
But Evan, so does the software scrub, or are you planning on adding artificial intelligence to help scrub and respond to folks so that the office manager or the staff don't have to?
I think where AI could be helpful is summarizing comments, right? You have a certain part of your business operation, you could actually summarize 50 comments, and that would be, just save people time. Responding is a little more tricky because sometimes AI doesn't get it right. I haven't seen where it's perfect. And the last thing you want to do is, you can have AI write a response, but you got to review it and look at it and approve it rather than just posting it automatically. I think that would be a little bit dangerous. You might get some unintended responses that you don't really want.
Gotcha. Yeah, one thing that I was very impressed with, I assume you're still doing this, but at least at one point, I know that a patient gave us some feedback pretty quickly about someone in the staff through the Rater8 process. And my administrator immediately reached out to them and said, how can we help you, and what happened? And, my feeling was that they were much less likely to go after the fact and leave a negative review because we resolved the issue. Right. As opposed to if they left the review publicly, then you try to resolve it, it's a lot more complicated.
Correct. So right. The patient checks out, your Athena, as soon as they're checked out, your Athena sends us a message and the patient gets a survey. They fill it out. If they're upset, then a low rating alert goes out immediately. So we've heard stories where patients are still in their car in their parking lot, and the CEO of the practice or office administrator or even a doctor's calling the patient trying to remediate the issue. And patients, you're right, no matter how upset the patient is, if you do that, they're not going to go home and post a 1-star review. There's no way. In fact, they might say, I love this practice. They're so responsive to my complaint. I'll give them a 5-star review.
Yeah, I think that's really very helpful, because a lot of times you don't know the patient's unhappy. Like, not a lot of people are comfortable telling you in your face, but they're much more comfortable filling out a survey and writing their negatives. So I think that's where you catch them before they go public.
Well, even myself, I don't want to trash my doctor online because they might see my name. So all our surveys at Rater8 are 100% anonymous. And then if we detect the patient is happy, we actually ask them, we say, we strive for 5 stars. Can we share your name with a manager? Your identity with with a manager. And if they click yes, and not all patients do, but the ones that click yes, share my name or my identity, those are the patients you better call, because they're saying, I want someone to call me. So it's very effective. They want to be called, they want to be heard, and they click the button, they get the call. You just mitigated a potentially upset patient.
I think it's great technology.
You
Very
know,
impressive.
it is, the whole process though can be, I mean, you've chunked it out into parcels, but there are multiple layers to a practice. You walk in the front door, you meet the front staff, there's the telephone folks, there's the billing people, there's the techs that do your visual field, that refract you, that ask, do the intake, the demographics. I mean, there's multiple components to the practice, and it's a supply chain. And to specifically identify a pain point or a choke point in that flow, that workflow, is really interesting and important. I mean, do you get down to that granular level with Rater8?
Yeah, so we have a benchmark of 160 different questions, and it's a bank of questions. So, and there's a long tail, right? Some of these questions are really esoteric questions that some practices ask, but the top questions, the top 10 or 15 questions, just like you mentioned, covered every area, every key area of practices operations. And some questions we have well over 1 million responses. So we have this just rich, robust benchmark. Our benchmark in total, we just hit 15 million data points. So we have this 15 million data point benchmark, and then all those key questions. So a practice selects a question. It's asked the same way across all of our clients. So we get consistent data, and then you're able, just like you mentioned, you're able to identify exactly where the problem is. And you can identify where the problem is by doctor. It could be a problem with a doctor. By location, could be a specific operational problem with a specific office location. Even appointment type, you could identify, let's say, I want to see new patients and what they think about the check-in experience. Maybe they're complaining the forms are too long. So you have new patients, follow-up patients, surgery patients. You get all sorts of data cut in so many different ways. And again, compared to a really robust benchmark.
That's great. Wow. It's really interesting. So congratulations. That's impressive what you've done. It's a great product. John, anything else?
No, was really a great summary. Very well done.
Right. So reputation management, Rater8, Evan Steele. Great to have you, Evan. We look forward to potentially learning more about the product and any more features. And perhaps if you do incorporate AI and you feel comfortable with it as it advances and becomes really more literate without hallucinations, perhaps we can talk about that later on. But Evan, great having you. John, always good seeing you, my friend. And we'll see you on the next video.
Thanks, guys. Nice to see you.
Have a nice
Thank
evening.
you.